Good morning, everyone. And first thing, I introduce myself. I'm Simone Volpi, Commercial Director of K-Surgery. And today I will show the line of filler. My part consists in the filler line for the face. After my presentation, there is the presentation of the doctor for filler line Opéra V. Let's go for the first slide. The first product is Opéra I. Opéra I is a soft filler. The indication for this filler is acne scar, barcode, periocular wrinkle, small wrinkle, obviously. The characteristic is the percentage of this hyaluronic acid is 20 milligram per milliliter, and pH 7, and inside the box there is 2 needles of 30 gauge. The second product is Opéra II. Opéra II is a medium filler. The indication for this filler is lips, deep middle folds, and superficial middle folds of glabella. It's possible to up the point of nose for a rhino filler. The percentage in this case is 22 milligram per milliliter, and the pH is the same, but in this case the needle is 27 gauge. Opéra III. Opéra III is a strong filler. This is probably the best seller of the line because it's possible to inject this product in the lip for increase the volume, a big volume for the lip, for nasolabial folds, okay, for marionette line, and for the temple. The characteristics of this product is the percentage as 24 milligram per milliliter, the pH the same, and the needle 27 gauge. The syringe, all syringe in the line is 1 ml. Opéra IV is extra strong for big volume, for deep furrows, for cheek, for pronunciation the chin and the malar area. In this case, the percentage is high, 25 milligram per milliliter. And inside the pack, there is 2 needles, 25 gauge. The pH is the same. Opéra Rev is a biorevitalizing. It's possible to inject this product in two techniques. The classic technique of the multi-points, or the innovative technique is BAP, bioaesthetic points. Is the indication and the results is very similar al profile of IPSA. 20 milligram per milliliter. The needle inside the pack is 30 gauge and a very easy flow injection. And this product is different because inside there is a small part of BDDA, is cross-linked product, but not for increase the volume, but for firming the face, firming action. My presentation is finished, and I introduce the doctor, Dr. Marco Bericotti, and he show you the Opéra V, the focus of today. He introduced the technique, the characteristics of this product, and after that, there is the demo live session with the patients. Thank you. Thank you for your attention. I hope see you soon. Bye-bye. Andavo. Sono comportato bene.
I'm Dr. Bericotti. I'm a general and aesthetic surgeon. Today I would like to speak about the body filler and to reshape the body profile. So what are our patients looking for? Improving their body, safe and non-invasive method, and rapid of the daily activities. So fitness as a reference model or as an option. Actually, sport activity is a good way to start reshaping gluteus or the full body, but it's not a valid and the only solution for all the patients, mainly because sometimes the shape they are looking for is quite unattainable. So, primum non nocere, first do no harm, Hippocrates. What are patients looking for, in my experience, and usually in Italy? Gluteus, arms, and calves. Which are the solutions up to now? Gluteoplasty without implants, gluteus implants, calf implants, and several strains on the arms. And usually the lipofilling of the gluteal region is the best possible alternative with visible results, even if it has some complications that sometimes could discourage most of patients and some doctors. But in this technique, there are a lot of complications. So bad sole, skin necrosis, serum accumulations, misplaced implants, and fantasy surgeon like the picture in the right of the mirror. We can see the scar in very fantasy area. Recent request, mostly because of the diffusion of new reference aesthetic models, is not surgical method newly used in a large scale in Italy, and high percentage of complications and failures if doctors are not well supported by theoretical and practical training. So, what to do then? So, learning about anatomy, discover the product, and now the method and the technique. Anatomy of the gluteus region. So it's very important to know this anatomy before to perform the procedures. And big and medium gluteus are thicker than sacrum, where they are combined to the ligaments sacroiliac structures. And very important to know the fascia, because the fascia is the landmark to the plane to inject the product. The skeletal anatomy. The skeletal anatomy is very important to know, very important to know the ischiatic tuberosity, because in the next slides we will see, because it's a learning mark to know if the patient have a ptosis of gluteus or not. Anatomy of vessels and nerves is less important, because this is in a deeper plane, so is not interesting to the technique. The larger projection should be 2/3 higher, and the gluteal fold there shouldn't be, or at most, within the medial half to the thigh. And the point of maximum projection should coincide sideways with a line passing to the upper margins of pubis in left image. And the trochanteric depression there shouldn't be, or just slightly. Discover the product. Okay, so this is a product made in Italy. Especially a feature of our product is extraordinary viscoelasticity. And Opéra V is the second filler on the market. It has been created to answer to nowadays trends, reshaping the body. Therefore, it works on large volumes. And Opéra V is usually used to arms, gluteus, and calves. The technique of injection. Okay, before is necessary to perform an access point. Usually I use a 18 gauge needle or blade number 11, or knocker needle. Slow and retrograde injection through 16 gauge cannula or needle. Distribution fan technique up to get the wished volume. Light massage of the implanted area. Implanted volumes vary from 30 milliliter to 100 milliliter per gluteus. How to treat and reshape the gluteus region. Using a body filler is completely different than working with a facial filler. Therefore, it's necessary to have a different approach and an accurate method of application with the assurance that the patient has previously understood the achievements and the limits of the methods. Because it's very different to inject 1 ml in the face or 10, 20, 30, 40, 50, 100 milliliter in gluteus. It's very important to perform objective static examination and objective dynamic examination before the treatment, because it's very important to establish the real volume and the shape of the big gluteus muscle, show any possible defects, and evaluation of the shape, volume, anatomical retrieval, possible ptosis. Ptosis, landmark. So I can use two landmarks named T-line and M-line. T-line is a line that goes through ischiatic tuberosity, and M-line is a vertical line through medium gluteus line. The ratio is that the gluteus fold has compared to the M and T-line. And the T-line determines the level of ptosis in the gluteus, okay? So, which volume does the patient wish? How many vials are necessary? How many treatments are needed in time? So it's important to make clear the limits of the method regarding the achievable volumes. Calculate the necessary number of vials and their distribution, and plan largest increases in more subsequent treatments. Preparation of treatment. So the first, informed consent. Second, picture and preparative drawing in the area that I would like to try to inject. Identify the point where to start, so the access point. And local regional anesthesia, yes or not. I usually perform anesthesia in only my patients. I usually use the cannula, and in my opinion, the cannula is the best to use than the needle, because it is less invasive than the needle. Suturing the points of access, yes or not? But in my experience, usually I don't put the stitches, because if the doctor don't put the stitches, the patient can feel the treatment like a treatment less invasive. And bandage. This is my patient, woman, 65 years, and I use 6 vials in right side and 6 vials in left side. So we can see the difference of the line of the gluteus. Okay, it's very different after the treatment. And the ischiatic tuberosity that I treat also this area. Reshape of calves region. So I will be very short, but it's very important to know the superficial muscle groups of the calf are wrapped in extensible and rigid bands. That's the reason why inflammatory or traumatic phenomena can determine an increase of the intrafascial pressure, resulting in symptoms of compressions. So, in this case, mild quantity of filler, more treatments when larger volumes are needed, compressive treatments, anti-edema therapy, and this recommendation is very important to avoid the compartmental syndrome. So it's very different, okay, to Gluteus, because in Gluteus I can inject 100 milliliter without complications, without a compartmental syndrome. But in this area, it's very important to inject mild quantity of filler and more treatments when larger volumes are needed. Traumatic outcomes of previous surgeries, what to do? But I usually use body filler in this case, in alternative to lipofilling liposolution, because lipofilling is often the ideal solution to correct traumatic outcomes of previous surgeries, but patients in Italy prefer more and more less invasive or non-surgical surgery with a fast recovery. Body filler, in my opinion, is a valid alternative appreciated by the patients. This is my patient, woman, 45 years. I use 1 box of body filler. In this case, I have a skin retraction for severe cellulitis. And in this other picture, this is a woman, 19 years old, 1 vials I inject in the area that before there was an injection of canacortase, cortisone. Okay, now let's start with the live section.